Why can't my doctor see me? Well, there are reasons, but none of them is acceptable. Welcome to Dr. Deane's webinars on healthcare, and I am your host, Dr. Deane Waldman. For those who don't know me, I am Professor Emeritus in Pediatrics, Pathology, and Decision Science. I serve on the Board of Directors of the New Mexico Health Insurance Exchange as the consumer advocate, and I'm honored to say I'm the author of The Cancer in the American Healthcare System. This is a series of webinars with a number of titles such as What's Really Happening in Healthcare? Should I buy health insurance or not? What would a good doctor do about healthcare? Is the Affordable Care Act the answer? Single payer won't work? Government bark is its bite? The Cure or Direct Pay USA? I urge you to take a look at that one. We don't need tort reform, and today we're going to answer the question, why can't my doctor see me? There are a number of reasons why your doctor can't see you. Number one, there are no doctors around. Number two, you are uninsured. Number three, you are insured. And then there are a number of buts. Number four, the doctor sees you but doesn't see you. And finally, we'll answer the question, what next? What should you do? There is a doctor shortage, and that's not just hyperbole. There is a fact of a doctor shortage. Between 1995 and 2010, the applications to U.S. medical schools fell by 20%. I have a good friend who is the director of a cardiac surgery training program. He told me that 2 years ago there were 120 open positions for training. 60 people had applied, and 40 of them were from outside the United States. You do the math. What happens if you have insurance and you have a heart attack, but you don't have a doctor to actually fix you? Why is there a doctor shortage? Well, 40% of doctors over the age of 50, that's the people who have experience and the ones you want, are considering early retirement. Most are dissatisfied, and we are dissatisfied for a number of reasons, but number one reason is because the system that's supposed to help us take care of patients actually obstructs us and penalizes us for doing what we're trying to do, which is the right thing for patients. There is, of course, maldistribution, namely the financial disincentive to be a general doctor and the financial incentive to be a specialist. And then, of course, most doctors tend to gravitate toward the big cities where the concentrations of patients are, and to be blunt, where the money is. And finally, why is there a doctor shortage? Well, with government reimbursement rates, we are now being paid less than the cost of staying in business. What's the effect of having a doctor shortage? I found that sign on the internet and just had to share it with you. And I also need to remind you that the cheapest solution to all major illnesses, for the word major, substitute the word expensive. The cheapest solution is death. So if money is your primary goal, let's shoot everybody who's sick. Obviously, I'm being facetious. I certainly hope you hear it in my voice. Now, why can't your doctor see you? Well, you have no insurance. Now, if you don't have insurance, that means you don't get preventative care and you don't get non-emergent care. You can get care through an emergency room, whatever care, because of a federal law 1986 called EMTALA, the Emergency Medical Transport and Active Labor Act, also known as the Anti-Dumping Law. But if you're critically ill, you'll be taken pretty much at once. If you're having a heart attack, if you're in an automobile accident, they jump all over you and try to do the best they can to save you. However, otherwise, you will wait and wait and wait forever. There was a recent article in our local paper showing an average wait time of 11 hours in the emergency room. Well, you have insurance, but you wait too long, or you wait forever to get the care you need that the insurance says you can have. Now, ordinary people stand in line and wait and wait and wait. For example, in Massachusetts, where they have the precursor of the Affordable Care Act, namely Romney Care, the average wait time for a woman with a new abdominal complaint was 48 days. Now, that means you're going to wait 6 weeks to find out whether you have gas or whether you have cancer in your abdomen. And as for our veterans, I trust you've seen in the newspaper, but let me just say it to you bluntly. This was from an internal report on the crisis in veteran care. By the way, veterans are in a single-payer system. Quote, 307,000 American veterans may have died while waiting for approved care. There's nothing I can say to follow that. You have insurance, but your doctor can't see you because she or he is not on your panel. So you get a list from your insurance company of a small number of doctors, but your doctor's name is not on the list. Now, insurance companies, United Health, for example, will reduce the number of doctors on their panels for the simple reason that reducing the number of doctors reduces their costs. Never mind the fact that it reduces your choices and it increases patient wait times and makes a mockery of the president's promise, if you like your doctor, you can keep your doctor. But there you go with you have insurance, but. Now, you have insurance. You purchased Obamacare bronze level insurance, and here's the good news. Essential benefits, as defined by the government, are covered. There's no lifetime cap, and the exclusion clause for pre-existing conditions is now illegal. Although I would ask you about those essential benefits. Why am I paying for maternity benefits for myself and my wife in our insurance? Now, I'm 72, my wife is 69, and I would love it if she were pregnant, but I have a feeling she would feel otherwise, not to mention astonished. Now, the bad news. It may have been the lowest monthly premium, that is bronze level, but it still costs you $850 a month for your family, and meanwhile, you have higher copays, you have much higher deductibles, and you have a much, much higher tax bill, mostly indirect hidden taxes that you don't see. So as a result, you may have insurance, but you still can't afford to go and see the doctor. Finally, you have insurance, but your doctor doesn't take any insurance. Why? Mainly because, firstly, government payment schedules are the same thing as insurance payment. In other words, if the government says we'll pay X for that procedure, insurance companies follow along. The payments are low and going down, and as I mentioned earlier, the payments have now reached the level where the cost of doing business is greater than what the doctors are getting paid. So as a result, more and more doctors are simply saying, okay, I won't take insurance. I will turn to concierge, or what is known as direct pay practice, which means forget insurance. Patient, just pay me a flat amount and I will take care of you. In the book that I mentioned earlier, The Cancer in the American Healthcare System, I relate a story that I heard while I was on the radio of a woman veteran who, to make a long and fascinating story short, went to her VA and found out that the price for the complex spine surgery she needed was over $126,000, and she got it through a concierge practice in Oklahoma for $11,500 cash on the barrelhead. She just paid them and got her care. You have insurance, but your doctor doesn't really see you. Why? Well, number one, she or he is staring at a computer screen. Number two, they spend more time filling out forms and more forms and more forms. Number three, they spend a lot of time on the whole regulatory burden and compliance with federal regulations, watching study modules on things that have nothing to do with patient care. And most important, As a result of HIPAA, they can't even talk to your other doctors. You may have a psychiatrist or a surgeon, and HIPAA makes it difficult or impossible for us to talk to each other. Finally, let me ask you a question. Do you want your physician to be efficient, because that's what the hospital or practice plan demands that the physician be? But I would remind you that efficient means seeing lots of patients per hour, which means efficient means no time for you. So what good is your insurance, I might ask? Your next steps. I urge you to visit the website called wecanfixhealthcare.info, not .com, .info. Consider all the information there. I give you the evidence. You make your own mind up. There are a number of webinars. I urge you to look at them. Just write down that little abbreviated URL and sign up. They're free. And finally, I recommend that people read The Cancer in the American Healthcare System, because when you do, you will find that you have the information you need to make the right decision for you instead of depending on somebody else.